All right, let's talk about Sotalol. It's a really powerful heart medication that honestly walks a very, very fine line. It's designed to stop some pretty life-threatening arrhythmias, but using it safely? Well, that requires a delicate and incredibly precise balancing act.
So let's just jump right into the big question, the central paradox of this drug. How on earth can something that's supposed to stop a dangerous heart rhythm also have the potential to cause one? It sounds crazy, right? This is the tightrope we're going to be walking today. So, how does it pull off this high wire act? Well, sotalol's power and also its risk comes from the fact that it's not just one type of drug. Nope. It's actually two different drugs working together, all packed into a single molecule. It's got two jobs to do. Okay, let's break down those two jobs. On one hand, you've got its class 3 action. Think of this as slowing down the heart's recharge time after each beat. It makes the heart cells take a little longer to get ready for the next electrical signal, which is great for shutting down those rogue electrical circuits that cause arrhythmias. Then, at the very same time, it's doing its class 2 job, which is being a beta blocker. This part blocks adrenaline, which calms things down, lowers the heart rate, and just generally reduces stress on the heart muscle. And this is what makes Sotalol so unique. It's not just one effect or the other, it's the synergy, the way they work together. This 1-2 punch creates a much more powerful and stable antiarrhythmic effect than either one of those actions could ever pull off on its own. So given how complex this is, what kind of mission would require a specialized tool like Sotalol? I mean, why would anyone take on the risk of this balancing act? The answer is pretty simple. It's reserved for some very specific and very serious conditions. Yeah, we are not talking about minor palpitations here. Sotalol is for the big stuff. It's used to help patients with atrial fibrillation or flutter stay in a normal rhythm. But even more critically, it's used to treat and prevent life-threatening conditions like ventricular tachycardia and ventricular fibrillation. These are the kinds of rhythm problems that can be immediately dangerous. Because the stakes are just so high, you can't just start taking Sotalol like you would any other pill. There is a strict, absolutely mandatory safety protocol. Think of it like a set of rules for walking this tightrope safely. So here's how it goes. First, you have to start the therapy in a hospital. This is not optional. For at least the first 3 days, you're hooked up to an ECG monitor 24/7, so doctors can see exactly how your heart is responding. Then, they increase the dose very, very slowly, bit by bit, and all the while, they are constantly checking your kidney function. So why the kidneys? What do they have to do with it? Well, it turns out the kidneys are basically the only way your body gets rid of Sotalol. So if your kidneys aren't working at 100%, the drug can't get out. It just builds up and up to toxic levels, and that dramatically increases the risk of all the dangerous side effects. That's why good kidney health is an absolute must for anyone taking this drug. And that leads us right to the next big topic. What happens if that balance is lost? What are the risks if you fall off this tightrope? The side effects are directly tied to those two jobs we just talked about. A lot of the more common side effects actually come from the beta blocker part of the drug. Things like an abnormally slow heart rate, which is called bradycardia, or feeling tired, dizzy, maybe a little short of breath. Now, these are things that can usually be managed, but they're not the main concern, not by a long shot. The most serious risk is something called proarrhythmia, and this gets right back to that paradox we started with. The drug can actually provoke the very problem it's supposed to treat, a brand new and potentially deadly abnormal heart rhythm. Its name is torsades des points. That's French for twisting of the points, which is basically what it looks like on an ECG, just chaos. It's a life-threatening rhythm that can happen when that electrical recharge time, the QT interval, gets stretched out way too far. It's like the heart takes too long to reset, leaving it wide open for disaster. This is the exact danger that the entire hospital safety protocol is designed to prevent. And now you can see why that protocol is so important, right? Doctors are constantly monitoring the ECG to watch for that QT interval getting too long. They're checking electrolytes because low potassium or magnesium is a huge trigger. They carefully manage the dose and watch the kidneys to prevent a toxic buildup. It all comes back to one thing: preventing torsades. So who shouldn't be taking this drug at all? Well, there are some absolute deal breakers. Since it's a beta blocker, it's a no-go for people with severe asthma. And if you already have a condition called long QT syndrome, you absolutely cannot take it. Then there are situations that demand extreme caution, like if you're taking it with other drugs that also prolong that QT interval. You've got to be so careful. So what's the final word on Sotalol? I think it's this: Using it safely and effectively isn't just about writing a prescription. It's a true partnership that demands incredible precision from both the medical team and, of course, the patient.
At the end of the day, this is not a drug for everybody, but for the right patient, someone who's been very carefully selected and is meticulously monitored, Sotalol can be an absolutely critical, truly life-changing tool in a cardiologist's arsenal.
So let's bring it all home. What are the key takeaways? Number one, Sotalol is a dual-action drug. It's used for serious, not minor, arrhythmias. Its biggest, most feared risk is causing a new arrhythmia called torsades de pointes, and its safety is completely dependent on that strict protocol of starting in hospital and carefully managing everything from the ECG to kidney function.
You know, the story of Sotalol is a really powerful lesson. It shows us that the more potent our medical tools become, the more precision and personalization they're going to require. It really makes you wonder, as we develop even more targeted therapies in the future, how much will success depend not just on the drug itself, but on the precise, careful system we build around it?